Hey guys, Mike Bills here with Measurable Solutions. I hope you're doing well. I wanted to just come to you and talk to you about something. I've been talking to quite a large number of practice owners lately, either on my webinars or just in person or Zoom calls or different things. And this question about what should I be having my staff do seems to just be coming up time and time and time again. So whether it's, now during COVID-19, if you guys are closed or if you're starting to open or whatever it might be, or you're thinking about how do I get my staff ready to be able to deliver services when we do open or when the state that I'm in or the county that I'm in starts to open back up, you really need to start to think about that now. Don't wait until the day that it happens, right? So if you have the PPP loan or you have another loan or you're working off of some of the HHS money or, your piggy bank, wherever your money is coming from, it doesn't really matter. You want to make sure that you've got a good plan in place, that you really know what is it that you want your staff doing, right? So I look at that and I say, okay, what should my staff be doing? Staff, what should they do? What should I have in place? Because I don't want to spend time when I get the loan or when the loan is running out and I'm in a rush or whatever it might be. I don't want to be spending time trying to figure that out then. I want to figure it out now. And so my answer to that question, what should my staff be doing, really comes down to the number one big thing is training. And so what can you be working on to train your staff right now? And why is it so important to train your staff? Well, it's important to train your staff partly because we will be practicing in a whole different method, a whole different way of delivery than we ever have before. Whether it's because we have to be wearing a mask, we have to be wearing gloves, we have to figure out a way to stay 6 feet apart, we have to separate people, bigger, we have to do it over a longer period of time, we can't be double booked. Whatever those things are, how we practice, at least I would say for the rest of 2020, is going to be completely different than how we practiced in the beginning of 2020 and in 2019 for sure. So we really have to make sure that we're really training our staff now so that as we start to ramp things back up, whether we're open now and ramping back up or we're going to open in a couple of weeks or whatever it is, we've got to start training our staff to operate differently. We can't expect that they're going to step out onto the clinic floor on day one and just everything's going to run smoothly. And so just like a sports team, they don't step out on the field to play that game without having practiced. No matter how many times they've practiced before, they practice for their new opponent this coming weekend, right? So even though it's summer or spring, baseball would typically be going on, those batters are practicing how to hit that pitcher they're going to go against tomorrow. And so we have to do the same thing with our staff. The opponent, if you will, the opponent that we used to have was just insurance companies and dealing with patients. But now we have this whole other opponent of how do we practice, how do we treat patients in the middle of COVID-19? And so we really need to work on training our staff so that they're prepared for that. What are the things that patients are going to say when they come into the office? They're going to be scared. They're going to be afraid. They're not going to want to share that space. They're not going to want to be on a bike with somebody near them. And we have to think all of those things through so that it's handled before it ever even comes about, right? And so I really want you to put focus on, again, training your staff. And so training them goes into a whole lot of different things, but training them to just have conversations and to really listen, to work on their listening skills. Again, if I'm not very trained in something, I will jump ahead and I won't let a patient finish talking, or I won't necessarily listen and hear what the patient says. I'll get a fixed idea and I'll jump on that, and I won't really be answering the patient and listening to the patient, right? So one of the biggest things that I hear and see in clinicians is that they think they understand what the patient is saying, but they didn't take enough time to actually listen to and ask questions to get a better idea of what they should be talking to the patient about. And now more than ever, if we're not listening to people, they're already heightened and they're already so anxious and tense and nervous. If we're not listening to them, it's going to create a break with them. They're going to go out of the practice running away and they're not going to come back. They're going to come in for that eval. They're not going to feel comfortable and they're not going to come back. And so we've really got to make sure that we're practicing and drilling and training our staff how to listen to our patients better. The next thing I would say that we really want to start to look at is Yeah, we need to be working on marketing and promoting. So promo and marketing is a big thing. And understand, that's a concept that for most of us PTs doesn't really come naturally. We can be doing all kinds of things online and sending all kinds of things in the mail and sending telegraphs and headless horsemen and whatever we're sending, but we aren't necessarily skilled in promotion. And so our staff need to be skilled in promotion, not skilled in necessarily in promotion in terms of sending out blogs and emails and things like that, but skilled in promoting their services so that that patient that comes in for the eval today, thinking that they were going to get just some exercises to do at home and ends up wanting to stop coming to therapy and just do the exercises at home. That's promotion. We have to promote to that patient so that they understand the value of coming in. And unless we really work with our staff on doing that, we're going to have some problems keeping our schedules full and getting our businesses back up and running. And so one of the biggest things I always say to my staff is, treating a patient is 80% of what goes on in their head and 20% of what goes on in the actual problem that they're having. And that's where it really comes down to that promo and marketing piece. I've got to really be good as a clinician, not only at treating that shoulder, but promoting why that shoulder needs to be here in the clinic being treated, or why I need 3 or 2 telehealth visits with you this week and next week and the week after and the week after that and the week after that. And if I'm not good at promoting and marketing that, you're going to find you get a lot of patients starting and you have a very few of them that are actually staying because I'm not good at promoting. And so again, now's the perfect time to start training our staff to promote things. And as we do that, we'll start to notice that we actually get a lot more full plans of care that a patient will actually sign up for and complete their full plan of care, which, again, if you think about it, it's really what we all got into this profession for in the first place. We didn't want to be told by some corporation that we had to discharge people and we had to see them for this long, etc. But at the same time, we get frustrated as clinicians when patients stop coming partway through treatment because in their minds, they're feeling better, they don't see the value in continuing, and now more than ever, money is going to be tighter, their time, they're scared to come out, etc. We have to be very good at getting patients to understand how to complete their full plan of care, and there are specific things that can be done to train your staff on how to do that. And really along the same way, then we start working on being able to help to reduce cancellations. That's a big thing. That's a big problem I hear from practice owners quite frequently is, I get plenty of new patients, but I have these cancellations that come in. Well, I'm here to tell you that you can have a 3 or a 4% cancellation on a weekly basis, week after week after week. Even during COVID-19, that's what we're seeing in our clinic because we've learned some tried and true methods to put in place to prevent cancellations, to get patients to truly understand the benefits of therapy such that they aren't afraid to come out, such that once they start, they come out, they become full plans, completed plans of care, etc. But it goes back to the fact that we spend time, all of the time, training. And so when I'm being asked right now, my staff, what should I have them do? Who should I bring back? What should I be doing with my staff? My number one answer to you is training. So for example, we have a day every week right now during all of this COVID-19. We're closed to patients, but we're still open. And as staff, we're working together to train and drill and work through all these things. Now, yes, some of the times as clinicians, we're actually spending time working on being better treaters. And I'm not saying that we don't need that. We all need to be better treaters. But the majority of the time in those, we're spending doing drills that take us through how to learn to be better listeners, how to actually be able to promote and market the things that we do so that our patients complete their full plan of care, they don't cancel, and then I have staff that automatically have something to do. And so I would say to you, if you're interested in finding more out about that, you should contact Measurable Solutions. It's where, as a client of Measurable Solutions, I learned what were the things I should be doing with my staff all the time. These are actions that we didn't just start during COVID-19. These are actions that we've been doing for years. They've helped us to build a very successful practice, and they've helped us to build a practice that even during COVID-19 is still doing well. So I want you to think about, really the emphasis is on, yes, what should I be doing with my staff? What should I have them do? Who should come back? Who's the right people? How do I bring them back, etc.? But most importantly, what should you be doing with them? It really comes down to training them to be good marketing and promoting people to patients that are already in the office, not necessarily out talking to doctors, etc., but just training your staff to be good at marketing and promoting. yes, help them to be better at treating and getting a good outcome. That's what we want. That's what our patients want. But at the same time, make sure that we're helping to reduce cancellations, get people to sign up for full plans of care, and making sure that we're working on getting those staff members that we have with us, utilizing this time to help them to be better rounded, not only just clinicians, but better rounded, in a sense, salespeople that are able to get those completed plans of care, get patients to buy into the plan of care, get patients to do things. And that comes from using this time and really helping our staff to be successful at that. And like I said, treating a patient, whether it's a shoulder patient, a back patient, whatever, is 80% what's in that patient's head, and me being able to understand that as the clinician, and 20% what's going on with their body. So I want you to take this time and this opportunity to really look at getting your staff in the office or on Zoom calls or whatever it is, and really working on training them, because that's really what's going to make the difference for you. Unless you want to be the person that's going to talk to every single patient coming into the office every day, especially as we come out of COVID-19, you need your staff to be able to do that. And so let's get your staff trained. Get in touch with Measurable Solutions. You can check out our website, measurablesolutions.com. You can private message me, you can text me, you can email me, Mike at FortisBusinessSolutions.com or 703-470-5995, or private message me on Facebook. I'm happy to get in communication with you, start talking. Let's talk about the ways that Measurable Solutions can help you to train your staff so that you not only come out of COVID-19 being good and strong, but you have a business that's growing and prospering into the future as well. So take care. Check out our website. Come on the webinars that we're doing every Tuesday and Thursday, ptwebinars.net. You can register for those. Actually, the one tomorrow is about staffing. So I look forward to seeing you there. I hope you guys are healthy. Contact me if there's any questions. Take care. Have a good day and be safe.